Yeah, the vision very much of Liverpool is that we want to be digital first, a digital city in effect, and we want to remove the organisational barriers that currently exist between technology and siloed data across the city. So at the moment we've got a best of breed system at the Royal. We need to replace that with a fully integrated electronic patient record, and we need to expand that across the other acute providers in the city, so Aintree and Liverpool Women's Hospital, so we've got a single view of the patient. So we're removing some of those siloed data and having it in one place, which means that we can research on that data, we can have better patient flow and idea on that. But we've also only got one system to manage rather than maybe 7 or 8 specialist systems delivering that care. So that's the first big driver, and that's due to go live by the end of 2018 across those 3 hospitals. We are a global digital exemplar at the Royal to build upon the good work that we've done using technology, and that's demonstrated by our high rankings in the digital maturity. But for innovations that we've developed in-house, such as electronic whiteboards, bedside observation, sepsis early warning, electronic news, etc., has enabled us to be recognised as a global digital exemplar. What we need to do now is take the gravitas that comes with that and the funding, because it does come with £10 million worth of funding, to then accelerate that through, so that within the next 3 years we can expand that broader. We can create a blueprint for other hospitals to come on board and use the same template, so we're not duplicating effort across the system. And at the end of it, we should end up with a world-class hospital with world-class IT that's HIMSS Level 7 accredited. I think the new Royal's a game changer because that enables us to transform the way that we deliver care. It does present some challenges, but the GD enables us to overcome that, because essentially we need to blur the gap between primary and secondary care and social care. And the reality is we need to work as one as a system, and therefore one as a technology platform. And I think what will stand Liverpool out from maybe others is I think we can get there quicker than other regions in the country because of all the good work that's already taken place. So there will be a single patient record, a single view, single access, not duplicated effort and resources, because fundamentally if we don't do that, we're not going to be able to afford the healthcare system of the future anyway, and it certainly won't be the best outcomes for our patients. And Liverpool doesn't have traditionally good outcomes for long-term conditions or cancer. We have one of the worst cancer outcome rates in the country. So we need to embrace the Healthy Liverpool programme to understand, well, how are we going to prevent that happening in the first place? And then how do we lever technology to ensure that that delivers? Because that's a 10-year plan, a 15-year plan. So childhood obesity, for example, you don't cure that overnight. So how do we get that into the learning? How do we build it into culture? How do we develop the apps that enable people to learn from that? And that's something which I think Liverpool's well placed to do.